5 miles east of Washington, D.C. at 1600 FedEx Way, there's a football stadium that's seen some of the worst injury luck in NFL history. With a slew of season-ending and graphic injuries, many people wonder if FedEx Field could be cursed. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to help teach you about the medical side of the sports world. In this video, we're going to walk through the plagued injury history at FedEx Field, now Commanders Field, talk about each injury, the anatomy, and also this bigger debate of grass versus artificial turf. The first notable injury occurred in 2013 to quarterback Robert Griffin's knee. Now, Griffin had been dealing with an injury to this right knee coming into the game that, ironically, there was some reporting was first said to be a strained ACL by Coach Shanahan, and then corrected to an LCL, which is the lateral collateral ligament on the outside of the knee. And we saw Griffin playing in this game with a really bulky hinge brace on his right knee. As he goes backwards to try and get this missed snap, you can see how that right knee buckles inward into this valgus position with his hip and femur kind of internally rotating, the right foot swinging outward as his trunk is starting to lean over that injured side, of course, resulting in, for Griffin, a torn ACL. Here we can see that big, bulky, hinged brace. This brace was undoubtedly trying to help secure and protect the LCL, or the lateral collateral ligament, that sits on the outside about right there in Griffin's knee. An injury that's a reasonable thing to try to play through if it was in fact just an LCL and not an ACL sprain. But then, of course, as we go through this whole sequence, we can see how Griffin's foot sticks into the turf. And one thing we'll talk about later on with this whole question of artificial turf versus grass, part of the reason why artificial turf seemed to cause so many more non-contact injuries historically was because it had a lot more friction. When there's a lot of friction, the foot grabs onto that turf, and all that force gets transmitted up from the ground through the foot into the joints. And so there's a higher risk of injury compared to more of that natural give of grass. So ironically in this, even though they're playing on a grass field, we see how Griffin's foot really gets stuck into that turf. It doesn't slide at all. All that force gets transferred up into the knee. That knee bends inward. The LCL is having a hard time stabilizing the knee. Force goes through the ACL and causes that ACL to rupture. We're going to talk about more ACL injuries later on in this video, so let's start off first with just a quick highlight of that anatomy so that we can understand it for future injuries. Of course, looking at the outside of the knee, this is going to be that LCL, lateral collateral ligament, running from the fibula up to the outer portion of the femur. The MCL is going to sit on the inside of the knee, protecting from more of that valgus stress coming inward. And then if we hide the patella deep on the inside portion of the knee, we're going to see the ACL and the PCL. The ACL running from the front of the tibia to the back side of the femur, and the PCL running in the opposite direction. So that ACL, when that knee goes inward, the twisting forces throughout the knee cause it to tear and rupture, like in RG3's case. Next, we're going to look at a different part of the body, but also an injury to Robert Griffin III. But first, I want to give a quick shout out to the sponsor of this video. Today's video is sponsored by DuckDuckGo. DuckDuckGo is known for its privacy browser and search engine, and now offers Privacy Pro with features that really help to step up your online security. Privacy Pro is a 3-in-1 subscription service, including a VPN, that helps protect your personal info from being exploited by hackers, scammers, and privacy-invasive companies. The DuckDuckGo VPN is easy to set up in just one click, and provides that extra layer of protection when shopping, traveling, or just browsing on the internet. But what do you do if your personal info is already out there? On desktop devices, Privacy Pro's personal information removal can help remove that personal info from online databases and people's search sites, and then take steps to help keep that information removed. And finally, their identity theft restoration service can help restore your identity if it gets stolen. The service offers 24/7 assistance, and most calls are answered in less than 30 seconds. Right now, you can try Privacy Pro free for 7 days at duckduckgo.com/Brian. After that, sign up for a monthly subscription for $9.99 or an annual for $99.99, saving you 16% or the equivalent of 2 free months. In an ever-increasing internet age, make sure you're taking these important steps to help keep your personal information safe and secure on the internet. Thank you again to DuckDuckGo for sponsoring the video. Make sure and check out their Privacy Pro program today, and let's get back to our learning. Next up, unfortunately, again, was Robert Griffin III. This time, different part of the body, different side on the left, suffering an ankle dislocation in this game, again at FedEx Field. We can see here we're looking at the left ankle. As Griffin is running out to the side here, we see how that foot plants into the ground. And what happens is an eversion mechanism where instead of the foot rolling outwards and inverting, twisting the ankle, we see an eversion position, which causes excessive stress on that medial deltoid complex in the ankle, potentially almost like a high ankle sprain mechanism, before ultimately leading to what we found out to be a dislocation of Griffin's left ankle. If we take a look at our anatomy tool here for this one, we can focus on the ankle anatomy. And most of the time when someone sprains their ankle, it's going to be an inversion mechanism where the ankle rolls. If we're looking straight on, the ankle rolls more in this direction, which is going to stress these outer lateral ankle ligaments. But in the case of Robert Griffin's dislocation, you get an eversion force where now the foot wants to go this way, the opposite direction, which is going to stress this deltoid ligament that sits on the inside or medial portion of the ankle, tearing that deltoid. And as that force continues, you can tear that syndesmotic connection between the fibula and the tibia, sort of like what we saw happen with Dak Prescott when he had his ankle fracture dislocation. Same sort of mechanism, almost the extreme of a high ankle sprain, where you get tearing of those ligaments, dislocation of that ankle joint between the talus and the tibia. Next up, we have Adrian Peterson, who sustained one of his ACL tears here on this play, also at FedEx Field. And his was the result of a contact mechanism. So when we were looking at Robert Griffin III's ACL, we saw it as non-contact, meaning there was no external load coming in and causing the knee to bend in a position that the ACL couldn't withstand its job. In this case, it's contact. So here there's nothing about how he plants and twists funny. We see a Washington player come in here, strike the knee from the outside. That imparts a valgus load with the knee bending inward. That's going to stress the MCL ligament on the inside of the knee, and when done to an excessive enough degree, also cause a rupture or a tear of the ACL. So same eventual injury, same pathology, just a different mechanism between contact and non-contact. We've got HD for the next one here, of course, Joe Burrow, another visiting player to suffer serious bad injury luck at FedEx Field. Now, here, of course, we talked about with Adrian Peterson, this was a contact mechanism. For Burrow, he also injured his ACL with a contact mechanism of injury. So here's Burrow is standing in the pocket, delivering the pass. There's no cut, plant, twist, pop like we see with non-contact ACLs. We see the Washington player come in and again impart this valgus force, landing on the outside of Burrow's knee, pushing it inward, causing that ACL ultimately to tear. With Burrow's injury, we actually get a much better example of what you can visually see when the ACL tears, and it's a really good learning point. So remember that ACL is trying to keep the tibia or the shin bone from going forward too much past the femur or past the thigh bone. So here at the start of this whole sequence, of course, we see that force come in from the outside, pushing Burrow's knee inward. And what we're actually going to see is that bump right there is that forward displacement, that anterior displacement of the tibia, the shin bone, relative to the thigh because of that ACL having been torn. If we follow this all the way through, then what you'll eventually see when the weight comes off and there's no more force going up through the knee, that bump right there will ultimately pop backwards up into its reduced position. And that's how we also can know from visually watching that the ACL has been torn. It's that translation of the tibia forward and then backwards when the ACL has been injured. The final notable ACL injury, of course, was to Chase Young. And we can see again, I'd call this more of an indirect contact. Again, there's no force coming in from the outside, bumping his right knee inward as he comes around the corner here to try and push off and change direction and get up at Tom Brady. But there is a shove from the offensive lineman, and that shove causes enough of a jolt or sort of a perturbation, an external force that's unexpected, pushes his weight over that right side as he goes to plant and cut and push off, which unfortunately led to an ACL tear as well. Now, the final two that we're going to talk about here are fractures. And I would argue that Alex Smith's was probably not the most serious we've actually seen on the football field, but the most serious in terms of the full recovery. I'll link the video up here in the show notes to go watch and actually see some of the pictures if you're interested. But let's take a look and talk briefly about Alex Smith's. Alex Smith suffered a compound spiral fracture, meaning a fracture where the bone actually popped out of the skin on this play, again at FedEx Field against the Houston Texans. Now, we're not going to show the bone snapping. That doesn't contribute to anything. But all you have to think about is when he gets rolled over here, his right leg gets pinned underneath him as he's twisted and rolled in this opposite direction. And because his ankle, his foot is basically fixed and rigid under the ground as his body is twisting, that twisting torsional force going up through the tibia, remember, it's because the foot is anchored. The ankle can't bend or move to take that load. All that load gets transferred up through the bone, resulting in that spiral sort of spinning fracture around the tibia, which ultimately led to the bone poking up out of the skin, which was, of course, what then caused all these subsequent complications. Now, an injury like this, when you see it on the football field, it's going to be very apparent that the bone is exposed and you've got a serious injury where this athlete needs to get to the hospital as quickly as possible. What we're going to do is we're going to try and grossly realign, get everything in as proper position as we can without putting too much stress on all the different tissues. We're going to probably put some sort of antiseptic, some cleaning solution over it as well to try and, again, help reduce the chances of infection setting in. We can see that Alex here had this air cast, basically a rigid splint where it goes on in a loose position. You suck all the air out of it and it becomes really rigid to help stabilize and immobilize that ankle and that leg on the way to the hospital. But for Smith, the real trouble was when infection set in that lower leg and in those muscles. Those muscles can die. They can become a source of infection. That infection bacteria can seed and spread throughout the body, causing you to become septic and ultimately can be fatal. You try and control the source. You try and debride, cut out that damaged, infected, dead tissue. You try and use IV antibiotics. But in the case of Smith, they had to remove a significant amount of tissue. And then everything that we see in his leg nowadays is because of muscle grafts and flaps that they had to basically take muscle from elsewhere in his body and use it to fill in the defects in the space from where they had cut out the dead necrotic muscle. Amazingly, he was able to come back and actually lead his team to the playoffs. One of the best comeback stories I think we've ever seen in sports, and not the most gruesome injury on the field we've seen at FedEx, but definitely the most serious in terms of post complications. The final injury to discuss here was quarterback Kyle Allen, ironically also a quarterback in a similar location on the field, similar spectrum sort of mechanism of injury, but just not as intense. Here, we talk about what happened with Robert Griffin's ankle dislocation and that similar high ankle sprain mechanism where all that force gets put through that ankle joint. Same sort of thing happened here with Kyle Allen. As the Giants player is falling down onto him, that traps his left ankle underneath, locked up against the turf. And as the force of that Giants player continues to wrap around, it simply pushes that ankle joint into an externally rotated eversion position beyond what it can sustain, causing, in this case, the ankle to dislocate and also fracture. When we talk about dislocations, you can have a simple or a complex dislocation. A simple joint dislocation is when there's no fracture at all. It's just the bone is out of place. This might be when you dislocate your finger if there's no fracture, or your kneecap if there's no fracture. Extremely, extremely uncommon to get a simple dislocation of the ankle because of how strong and rigid of a joint it is, with the talus, this bone right here highlighted, surrounded by the mortise of the tibia and the fibula. So majority of the time, I think Karis LeVert was an example of an NBA player who had a pure dislocation with no fracture, but of course, Gordon Hayward, dislocation with fracture. Kyle Allen's case, dislocation with at least a small fracture, because it's really hard to get that bone out of the joint without at least breaking some of these passive external supports. But of course, he had a good recovery, no issues with infection like we saw with Alex Smith. So without a doubt, FedEx Field has seen some really bad injury luck. And while I don't know if the numbers exactly add up to it being the most injury-prone stadium, it seems to have at least had some of the most high-profile injuries in recent history. I would also throw out there where the Bengals play. Of course, we saw with Damar Hamlin. I believe that's also where Ryan Shazier suffered his spinal cord injury. Two really serious injuries at that place as well. And I just want to wrap up with talking about the grass versus turf discussion briefly. We're not going to go into full depth with it because that could be a whole other video. Obviously, FedEx Field is grass, and we've just made a whole video talking about all the terrible injuries that have happened on a grass field. A lot of people assume that you're going to have more of these severe injuries on turf versus grass, and it really depends on what time frame of data you're looking at. This was from the NFL. Their 2023 season takeaway, they talked about overall trends with injuries, and specifically said when it came to injury rates on grass versus artificial turf, injury rates were similar. In fact, they believe that a lot of the reason that this had been improved from previous years was because of better shoe surface interactions and players wearing more appropriate cleat styles on the artificial turf and the grass fields. Interestingly, if you look at this big lengthy report from the NFL Players Association, I believe, to the NFL regarding injuries on artificial surfaces versus grass, they go through and they plot all of this data they have from tracking their injuries about injury rates on synthetic versus natural fields. And you can see some of their data here. Regular season 2018 to 21, missed time for non-contact injury. So this is not going to count for when someone gets rolled up on and stuff you can't prevent from playing type. I really do think you have to look at non-contact like they're doing here. And you can see 18, 19, 20, there was a difference between injury rates with higher injuries on synthetic versus natural. Now on this graph, these little error bars that you see denote where we would consider something statistically significant if there's no overlap. So very, very close 2019 in terms of maybe being some overlap where it's not statistically significant. We saw the trend switch a little bit into 2021, where now it was much, much closer in terms of injury difference. There was some changing in the reporting and the EMR, and so this was data 2015 to 2020. Again, maybe a little bit higher when you look at synthetic surfaces versus natural. And then data from 2022, they again are saying that it was as wide as ever in terms of the gap between higher injuries, non-contact on synthetic versus natural grass. And again, it all comes down to this idea of the friction on that field and the cleats. And so it's not just the field that players are playing on, it's also the cleats that they're using and how the field and the cleat interact with one another, because that's how all these non-contact forces get transmitted up through the joints. You move, you cut, you pivot, your foot is anchored into the ground, and these forces come up through the joints into the tissues and cause injury. So if you are playing on a slippery, greased field, everything slips and slides around, you're not going to have any non-contact ACL tears. But when you're rigid, locked into the field, that increases that friction, which can increase those joint reaction forces from the ground up through the joints. Players also talk about artificial fields being too firm. I've just experienced this anecdotally covering sports with college teams here. You go to some artificial stadiums and it is like you're on concrete versus the more soft, newer kind of artificial surfaces and also grass. So there's a lot of different factors in play. And I think as much as you want to parse out the data, of course, the NFL will say that recently there's been no difference. A lot of the newer fields, a lot of the newer styles of artificial turf are much, much better than the old school AstroTurf of way back in the day. So if you look at older studies where it was a lot more AstroTurf, not as good artificial surfaces, you'll see a higher injury rate with artificial versus grass. But if you look at more of the newer surfaces, newer artificial field technology, companies are trying to do what they can to decrease that injury rate by changing that friction, by changing that firmness of the field to mimic more of a natural grass. And I will say at the end of the day, I think most people would rather play on a well-maintained field than a bad field. So for example, if you're going to have a natural grass field, but it's going to be full of holes, it's going to be all chewed up, it's going to be all uneven and bumpy, that's more risk than playing on an artificial field that's nice and smooth and consistent. But if you can have a well-maintained grass field, then by all means, play on a grass field if you have the resources to maintain it, to make it nice and stable. We heard everything about what happened with the Super Bowl where the Rams, everybody was talking about the field being a mess and chunks flying up. So you don't want that despite it being grass. You want a well-maintained field. And if it can be grass, I think we should push for that. But I don't think there's as much bad data out there on these newer artificial surfaces. And like I said, bad stuff is going to happen on grass regardless. We saw all these terrible things that happened at FedEx Field, now Commanders Field, on a natural grass surface. Let me know what you guys think in the comments below. What other stadiums can you think of that might take priority in terms of worse injury luck or just more overall injuries? And also let me know your thoughts on the grass versus turf debate. Thank you as always for watching. Let me know any questions or comments, and until next time, we'll see you later. Bye.